Good day everyone, I am your student nurse Gerald Ababa Bisara from Davao Doctors College of Davao, and today I am going to be demonstrating the assessment of the eyes. So, we all know that our eyes are an important organ for our sense of sight. That's why we need to take care of it and have at least an annual eye exams. So let's proceed to the pre-introductory phase. So prior to conduct the procedure of the assessment is to review the client's previous medical records if available. Okay. So this is done in order for us to know the previous medical history of the patient to provide focus for the physical assessment of the patient. Next, to determine the scope of assessment needed and prepare necessary equipment. This is done for us to be able to know the extent of our physical assessment, and also preparing all the necessary equipment needed saves time and energy. So these equipments includes the following: the Snellen chart or E-chart, so which will be read by the patient in testing for visual acuity. Next is the opaque card. So the opaque card, when we will be used, or it will be used to cover the one eye while observing the uncovered eye. Next is the working gloves. So to prevent cross-contamination, since we might be touching some parts of our patient's face. Lastly, or next, is the pen light. Wait for a second. The pen light. So, which we will be used in testing for light perception. And lastly, pen and also the patient's chart or any jot down notes for the documentation. Then, perform hand hygiene and don gloves if necessary. So now we are done donning our hands. First is to greet the client politely and the client's companion if around. So now let's meet our patient. So I'll just put aside the materials that I'll be using. So then, to introduce myself and verify the client's identity using the two identifiers, which is their name and birthday, then I'm going to ask how the client would like to be called during the assessment, and also establish rapport with the client. So verifying the client's identity helps us to know if the client have the correct, or I have the correct client, and the client makes them feel comfortable and less anxious. So hi sir, my name is Gerald Ababa Bisara, your student nurse for today. For verification, may I know your complete name please? Or before anything else, can I have your wristband? So, can you please state me your full name?
I am Joshua P. Fernandez.
Your birthday?
January 10, 2004.
Okay, great. So, how do you want me to call you?
Joshua.
Okay, Joshua. So, Joshua, what dialect do you prefer?
English.
English. Okay. Now, I will explain the procedure to the client and how he can participate during the assessment. I will ask them to provide the client the opportunity to clarify and ask or raise any concern. This is done to elicit cooperation from the client, and providing the opportunity to ask helps us to know if there's more information that our client would like to know more about. So, sir, the procedure we are going to do is called assessment of the eye. So this procedure we will check your eyes to see if you can see clearly in distance, in the dark, and in the light, and if there are any angles that you can see or not. So we have these positions, sir. So where you sit and stand, then I will have read from a distance, and there will be a light that will be shown close to you. Is that okay with you?
Yes.
So if there are any concern or clarifications, free to ask me, all right? Okay. So then, I am going to ensure my client's comfort, privacy, and confidentiality. Also, the assessment setting is assured to be safe, secured, and free from distractions. Make sure to position the client to a comfortable sitting position. This is done in order to provide comfort to the client during the assessment and also to provide dignity and have an entrusting relationship with the client. So I will just close the door first. Next is to adjust the room temperature and adjust the curtains. So, sir, are you comfortable with your current position?
Yes.
So, okay. So, don't you worry, sir, because all the results and information that you will given me will remain confidential. It will remain to the both of us, and especially to your physician, and also, nonetheless, to your physician and to me. Okay, do you understand?
Yes.
Okay, now let's proceed in the working phase. So let's start in assessing the visual acuity. First, check for use of any visual aids prior to starting the test. This includes the glasses. So if the client is wearing graded glasses, make sure to let the client wear it during the test. But if the client has reading glasses, tell them to remove it since it can cause blurred vision. So, sir, do you wear any contact lenses right now?
No.
Okay, then great. Okay, so now I am going to let my client stand 20 feet or 16 meters from this Snellen chart. Then cover the eye being tested and ask his to read each line until he cannot decipher the letters or the directions. Now, I will take the 3 readings. First is going to read it using the right eye, then the left eye, and after that, I will let him read it using the both eyes of my patient. So this will allow me to compare the results of each eye and provide a more comprehensive assessment of a visual acuity. So, sir, can you please stand? And then hold this oblique cord. Then, okay, so stand on this position. Okay, great. So, sir, can you please read the Snellen chart?
E, F, P.
But before that, sir, can you please cover your right eye first? No, right eye first, sir. Then left, then release. Okay?
E, F, P, T, O, G, L, P, E, D, P, E, C, F, D, E, D, F, C, G, P. F, E, L, O, P, Z, D, D, E, F, E, O, J, E, E, C. L, E, F, G, D, F, C, P.
Okay, very good. So I will just document that. How about your other eye, sir? Can you please cover it? Read it, sir.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, G, P, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, G, D, F, C, T.
Okay, now, sir, put down your hands and read it on your both eyes.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, G, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, G, D, F, C, T.
Okay, so can you please return? You're good. Then record the readings of each eye and both eyes. So this includes the smallest line from which the person is able to read 1/2 or more of the letters. So as what I have shown in the video that I was documenting while my patient is reading the Snellen chart. So because recording the readings is important to proper diagnosis and treatment. So now perform selected vision test, light perception, hand movements, then counting fingers if necessary. If the client is unable to see even the top line, which is the letter E, 20/200 of the Snellen type chart. So, okay. So, okay, sir. So, can you please face me? Then, what is this?
1,
How about this?
2,
This?
3,
This?
2,
This?
1.
Very good. Now, counting fingers. So, as what I have shown you earlier, I am doing the counting fingers. Now is the hand movements. So, sir, I have to do the hand movements. Is that okay with you? So, okay. So, sir, this. Please tell me if what I am pointing in what side. If it left, right, above, or beneath. Okay. This.
Left, beneath, above, right.
Okay. Cover your eye. And when you. Okay.
Left, right, up, beneath.
Other eye.
Beneath, left, above, right.
Okay, then, okay, very good. Next is the light perception. The light perception. So, sir, I am going to light your face. Is that okay with you? So, can you
Yes.
please cover your right eye for me using the oblique card or the oblique card? Okay, so just watch my nose, sir. Okay, so I will just sit down. Okay, so face me. Okay. Do you see the light?
Yes.
This.
Left, beneath,
Okay.
right, above,
Okay, the right eye. Okay.
beneath, right, above,
Okay, very good. So, all your eyes.
beneath, left, right,
Okay.
left.
Okay, very good. Now, that's it. That's how you do it. Next is to proceed but before that, I will just gonna document the assessment. Now, I will face the patient directly at a distance of 60 to 90 centimeters or 2 to 3 feet. So, I will just sit down as what I have shown you earlier. Then, I will inspect the client to cover the right eye with the card and look directly at my nose. Okay, sir, so can you please, okay, cover your right eye. Then look at my nose. Okay, good. So I will also cover my eyes directly opposite to the client's covered eye and look directly at the client's nose as what I have shown you earlier. Now I will then hold the pen light with a finger and extended my arm and move the object into the visual field from the various points in the periphery. Note that the object should be at equal distance from the client and me. So, okay, sir, cover your eye. Right eye and next eye. Okay, good. Then ask the clients to report when the moving object is first spotted. So these tests will assess the client's ability to follow a moving object while maintaining a fixed gaze on a target, which is my nose. Now, I will just repeat the steps for the other eye and reverse the process. So these allow the compare and contrast the results for each eye. So, sir, can you please cover your eye? Your right eye, okay. So, notice if there are moving.
Yes,
Okay,
yes,
okay,
yes,
okay. Next eye. How about this?
yes,
How about this?
yes,
This?
yes,
Okay, great. Okay, you're all face or you're all eye. Okay,
yes,
this.
yes,
How about this?
yes.
Very good. So we have to visually inspect for eyes for alignment and symmetry to identify any visible abnormalities that may affect any movement and coordination. Then inspect the eyebrows for hair distributions and alignment and skin quality and movement. Then ask the client to raise and lower the eyebrows. Then inspect the eyelashes for the evenness of distribution and direction of curl. So, okay. So just inspect. Okay. Okay, so go, skip, go.
Come. Go.
You know, go now.
1, 2, 3, go.
Then inspect the eyelids for surface characteristics, for example, skin quality and texture, position in relation to the cornea, ability to blink, and frequency of blinking. Then inspect the lower eyelids while the client's eyes are closed. Okay, so sir. Okay. No. Kindly look at me. Okay. Now, let's document all the results that I have gathered, especially in the skin, you know, in his eyes and all. Okay. Then inspect the area over the lacrimal gland and lacrimal sac for swelling. So this is the inner canthus. So inspect it if there are any swelling, but in my patient's case, there are no swelling. So let's move on. Ask the patient to look up, depress the lower lid of the patient with one's thumbs, and afterwards to assess the sclera and bulbar conjunctiva. So sir, can you please look up? Okay. Now, invert the eyelid, assess the palpebral conjunctiva using the cotton bud. So this is done to evaluate the color, texture, and presence of any discharge. But I don't use any, or I don't have any cotton buds. I will just use my hands since I am using working gloves. Okay. Okay. Next is inspect each corneal and lens opacities, clarity, and texture. Shine a pen light from a side toward the eye, or shine the pen light at the oblique angle of the eye, and move the light slowly across the corneal surface. Ask the client to look straight ahead while doing so. So sir, I will be using the pen light to lighten your cornea, the sides of your cornea. Would that be okay? Okay. So can you please face me? Just focus into my face. Not last one. Okay. The cornea is great. It shines. The light bounces, which indicates normal. Okay. Now assessing direct and consensual papillary reaction to light. So assess each pupils and direct and consensual reaction to light. So I will darken the room partially. Ask the client to look into the distance, then shine a light obliquely into each pupil in turn, using a pen light approaching from the side, and look for direct and consensual reaction. So sir, or Joshua, I will be turn off the light. So I am sure that the room would be dark, but trust me, this is for your own good and to test or to give the best intervention that will suit your needs. So I will turn off the light. Okay. So just focus to the light. Okay. Okay, great. So I will turn on the lights right now. Now, assessing the accommodation, assess each pupil's reaction accommodation. Hold an object, a pen light or a pencil, about 10 centimeters or 4 inches from the bridge of the client's nose. Then ask the client to look first at the top of the object and then at a distance object. Example, the far wall. Okay, sir. So do you understand that? So first, I will place a ball pen like this. Focus into the ball pen, then focus into the wall. Okay. So let's practice. Focus to the ball pen. Focus to the wall. Focus to the ball pen. Focus to the wall. Very good. So that is the test. So behind the pen light, instruct the patient to alternate gaze as what I have instructed my patient to alternately gaze his eye to the pencil and into the wall. So, sir, let's proceed. So, you can also use this wall. Okay. Okay, how about this? Very good. Okay. Now is performing the Hirschberg test. So assess ocular alignment arising from the extraocular muscle. So from 2 feet directly in front of the patient, shine a light onto the patient's eye and ask the patient to look at it. Then inspect the reflections of the corneas and look at direct the conceptual reaction. Okay. Focus into my face. Last one. Okay, great. Now we're going to perform the cardinal fields of gaze test. So the extraocular muscle test. Assess the extraocular muscle movements, looking for normal conjugate movement of the eyes in each direction or any deviation from normal, nystagmus, lead log, and convergence. So stand 2 to 3 feet in front of the patient. Then ask the patient to follow the examiner's or me fingers or pencil while making a wide H in the air. So this movement, H movement. And look for jerky movements of nystagmus on the lateral gaze and on upward gaze. Also, watch for a rim of sclera between the upper lid and iris as the eyes move up and down to determine the eye alignment of and coordination. So I will stand 3 feet to 2 feet in my patient. So, sir, I will be making an H pattern. So kindly follow the pen. Okay, would that be okay?
Yes.
Okay, now let's proceed. Very good. Next one. Next is testing for convergence. Ask the patient to look at the examiner's fingers as the examiner moves it towards the bridge of the nose. Then check for the eye convergence. So, sir, I will be pointing my fingers into your bridge. So, can you please face me? Okay. I will be pointing my fingers into your nose bridge. Will that be okay?
Yes.
Okay. So just follow my fingers. Okay. So. Okay. So let us first document. So I am done all documenting. So now let's proceed to the summary and closing phase. Now that we're done with the assessment, I'll just do a recap on the information that I obtained during the assessment. So, sir, I'd like to sum up everything. So your usual acuity scored, or your visual acuity scored 20/20, which is normal. So the right and left and both eyes. Visual field is normal. External structure, eyebrows are symmetrical and evenly distributed, and eyelashes are also normal. Skin is also intact into your eyes, and especially into your lids. Sclera appears white and no presence of swelling in the conjunctiva. So ocular motor is normal. Direct concentrium papillary response is normal. Extraocular muscle left shows good eye coordination. And near point of the convergence is around 8 centimeters, and convergence recovery is normal. So overall, everything is normal. So I'd like to advise you, sir, that in order for you to maintain your good eyesight, kindly eat leafy vegetables, especially kindly you don't use your phone every day, so that you could maintain your good eyesight. Then you could also intake vitamin E or any supplements that can that could have a good effects into our eyesights. So that's it. That's our assessment. And do you have any clarifications?
No.
And if none, thank you so much for your cooperation.
Thank you.
Thank you.